Hello and welcome again to the NCLEX Made Simple YouTube channel. Here we demystify the imagination that NCLEX exam is hard. We do this by giving you content that is relatable, articulate, and easy to grasp for your NCLEX preparation. Today we are going to talk about a condition known as autonomic dysreflexia. Autonomic dysreflexia is also known as hyperreflexia. So let us now ask ourselves, what is autonomic dysreflexia? Autonomic dysreflexia is a medical emergency, meaning it is life-threatening. It is a medical emergency that occurs due to sudden nervous response to a condition that irritates the body below the site of the spinal cord injury. So which site is this? It can happen to people with spinal cord injury at thoracic 6 or higher, T6 or higher. From the diagram there, you can see that there are 12 vertebral thoracic bones from T1 all the way to T12. The spinal cord injury at T6 or higher, meaning T7, T8, you go below that site. Then the lumbar region and the sacral region, that is the site below the T6. Any patient with spinal cord injury along that part of the spinal cord can suffer autonomic dysreflexia. So autonomic dysreflexia requires immediate attention because this condition raises the blood pressure so high that it can cause death. It raises the BP so high that even death can occur. So what are the triggers? For the purpose of your NCLEX, remember the causes of autonomic dysreflexia revolve around 3 B's. 1 is bladder. Number 2 is bowel. Number 3 is breakdown of skin. The bladder is the most common. So anything around the bladder, full bladder, kinked tubings of the catheter and the urine bag, urinary tract infections, kidney stones, think around the bladder. The bowel, impacted bowel, constipation, abdominal distension can cause autonomic dysreflexia. Breakdown of the skin, the pressure sores, ingrown toenails, anything that irritates the skin and it's painful can cause autonomic dysreflexia. So what are the causes? We have said that the triggers are the 3 B's: bladder, bowel, and breakdown of the skin. So when you look at the causes, it's just about the same thing. Full bladder, full bowel or constipation, bladder infections or bladder stones. Tests that are done on the bladder can cause stimulation, and this can lead to high blood pressure. We have pressure sores, labor and delivery. So those patients with spinal cord injuries and they go into labor and delivery can suffer autonomic dysreflexia. Genital stimulation, sexual activity, ejaculation, tight clothing or shoes, severe menstrual cramps, fracture bones. This is traumatic pain and can cause autonomic dysreflexia. Ingrown toenails. So it is good to check and assess these patients for this condition. The other causes are abdominal medical problems, gallstones, appendicitis, kidney stones, ulcers. We have said labor and delivery, hot and cold temperatures. So it is good to tell patients with spinal cord injury to avoid hot and cold temperatures that even can lead to sunburn. Also some drugs such as digoxin can cause autonomic dysreflexia. So in autonomic dysreflexia, an individual's blood pressure may rise to dangerous levels, and if not treated, can lead to stroke and possibly death. Let's look at the pathophysiology of autonomic dysreflexia. We know that the nervous system subdivides into central nervous system and peripheral nervous system. Now, the central nervous system is the brain and the spinal cord. Everything else is the peripheral nervous system. Now, the peripheral nervous system has 2 main subsystems. That is the autonomic and the somatic. Autonomic, these are nervous system processes your brain runs automatically even without thinking about them. That's what we call autonomic. Somatic are functions that you manage by thinking about them. When you look at the autonomic nervous system, you have the sympathetic and parasympathetic. The sympathetic system is associated with the fight or flight response, and parasympathetic activity is referred to as the epithet of rest, digestion, and relaxing. So sympathetic is fight or flight, while the parasympathetic system does the opposite. The 2 systems oppose each other. Parasympathetic activities involved with rest, digestion, and just chilling and relaxing. Homeostasis is when we have a balance of the two systems, that is sympathetic and parasympathetic. For example, during the sympathetic system, we can have vasoconstriction, and that is very important for this condition, autonomic dysreflexia, because we experience very high blood pressures. Then we have sweat gland stimulation, dilatation of the pupils, bronchodilation, and increased heart rate. That is the sympathetic. Now, parasympathetic does something opposite of the sympathetic system. So where we have vasoconstriction in sympathetic, then in parasympathetic we have vasodilation. Vessels dilate and the blood pressures goes down. We have decreased heart rate, we have salivation, bronchoconstrictions, constriction of the pupils, and the BP drops by stimulating the vagus nerve. Now let us look at the symptoms. Symptoms of autonomic dysreflexia. This is important. A throbbing, pounding headache. Patient will suffer from a throbbing, pounding headache. There will be hypertension. Systolic blood pressure will go high by 20 to 40 millimeters of mercury, higher than the baseline. Mostly you will find that most of the patients with spinal cord injury may have hypertension. So it's important to look at the systolic blood pressure. If it is 20 millimeters of mercury higher, 20 to 40 millimeters of mercury higher than the baseline, think about autonomic dysreflexia. A flushed face or red blotches on the skin above the level of the spine, above the level of the spinal injury. That is very important to note. Not below, but above. Flushed face above the site of the injury. Then sweating above the level of the spinal injury. Also sweating is above the level of the spinal injury. There will be nasal stuffiness of the nose, nausea. There will also be a slow heart rate. That is what you call bradycardia, due to baroreceptor response to increased blood pressure. So when the blood pressure goes up, the baroreceptors will try to trigger a parasympathetic activity, and this will cause vasodilation. So the patient will have a slow heart rate, what we call bradycardia. The goosebumps will be below the level of the spinal injury, and also below the spinal injury there will also be a cold, clammy, and pale skin. Cold, clammy, and pale skin below the level of the spinal injury. So what are we saying? Goosebumps, cold, clammy, pale skin below the level of the injury, flushed face, and sweating above the level of the spinal injury. So that's very important to note for your NCLEX exam. So how do you manage autonomic dysreflexia? So when you find a patient suffering from autonomic dysreflexia, raise the head of the bed 90 degrees or sit upright with legs dangling or lowered. This will decrease the blood pressure. Also loosen the tight clothing, leg bag straps, jewelries, other devices, shoes. Just loosen the tight clothing. Monitor blood pressure every 5 minutes. Check for the causes of autonomic dysreflexia. We said the number one trigger is the bladder. Now go quickly and check the bladder. Is it full? Empty the bladder. And now when you're emptying the bladder, if you have now to catheterize, consider using the topical anesthetic for lubricating of the catheter. Why are we using the topical anesthesia for lubricating the catheter? This is because we are avoiding stimulation, any pain stimulation that can cause the high blood pressure. So use an in and out catheter. You put in and out. That means you're not going to use an indwelling catheter in this case. Check for the kinks in the tubing. Check for the full leg bag. That is the urine bag. Check whether it is full and empty. Check the Foley's catheter. You can even change it because we have said even urinary tract infections can trigger the autonomic dysreflexia condition. So the other thing is check for the rectum, for stool. There could be fecal impaction. Apply an anesthetic gel to the rectal walls. before any manipulation. And now we have said that this decreases stimulation, which could cause the blood pressure to increase even more. Remember, it is already high in autonomic dysreflexia. So use digital stimulation to promote reflex defecation. We want to empty these bowels. Also, number 3, check your skin for the wrinkles. So it's very important to keep turning this patient every 2 hours and straighten the bed sheet so that we do not trigger this autonomic dysreflexia. So they check the skin for wrinkles, constrictions, and even tight clothing. Also, the other thing is to check for other sources of autonomic dysreflexia. We have seen something like ingrown toenails, fractures, ulcers, etc. Also, during the management of this condition, administer antihypertensive for blood pressure control. Here we can give captopril, nifedipine, we can give nitropast, and other IV antihypertensive medications, such as even hydralazine when the BP remains refractory. So that is the end. We have come to the end of the autonomic dysreflexia. I hope you have been able to learn and you'll be able to remember most of the points about autonomic dysreflexia. So now we always give you a chance to test yourself on the knowledge that you have learned, and that is where we give you 10 NCLEX questions from the condition that we have just learned, that is autonomic dysreflexia. Just read the questions. We have provided you with a question. We have also given you an answer and a rationale. Try to test your knowledge and try to see whether you can be able to answer these questions correctly. Thank you for being with us throughout this session. I hope this video will be of great impact as you prepare for your NCLEX exam. Subscribe if you have not subscribed to our channel. Kindly subscribe, because when you do so, you'll be getting notifications as we upload more videos, and this will help you with your preparation for the NCLEX exam. Go there, subscribe, like those videos, and share so that even more people can be able to get these content and benefit from them, just like they have been of great help to you. So thank you so much, and let us see each other in our next video.